Hello guys, again let's do the next question. Let's do these questions is no answer, so we don't know the answer. So you in your mind you can pick with option will you pick. So it's good for like a practice. Okay, let's read. Let's start. It is a 44 years old man come to the office for follow up after being evaluated in the emergency department for a shoulder injury. So the 44 years man with shoulder injury. 2 weeks ago, the patient fell on a stretch hand at work. So her hands was stretched at forward. So in the X-ray, the hospital showed a posterior glenohumeral dislocation without fracture. It was what the X-ray hospital showed a posterior glenohumeral dislocation without fracture. The dislocation was reduced successfully under procedure sedation. Okay, the patient was sleeping and they put it back, and then the arm was placed in a sling. Okay, the patient was advised to follow up with the outpatient provider 2 weeks later. Since the injury, he has been unable to abduct the arm without severe pain and difficulty. Okay, he has no medical history and take no medications regularly. On examination, the patient has no shoulder numbness, no has limited abduction due to pain. So the patient has no shoulder numbness, but has limited abduction due to pain. Distal pulses and sensations are intact. There is no shoulder asymmetry. Which of the following is the most likely cause of this patient's current symptoms? So what happened with this patient? He cannot abduct the arm. He cannot take the arm out. That's what I mean, like out of your body. That's the abduction. Where's the word? Let me see. The words abduction. What is it? So guys, read and think for a second. Just remember, for educate purpose, like a abduction. When you see a V and a D, uh, that means like a you open your arms like a out. You see, this is pointing out. This is pointing out. So when you see abduction, that's mean open. But abduction sound like a add, like a bring your arms to your body. That's mean add abduction. So in this case, abduction is like a open your arms. So he cannot he cannot do like a T with his body when he open his both arm. So the question is why when he say here shoulder asymmetry, there's no shoulder asymmetry. That means that the shoulder is back in place. It's not out of the or of the glomerular. There's no another glomerular dislocation. So which of the following is the most likely cause of this patient's current symptoms? So could be adhesive capsulitis, a vascular necrosis of the humeral head. Could be axillary nerve injury. I don't think so because they say uh, the sensation is intact. So that's I'll rule out this one. So recurrent dislocation, no, because we just say that shoulder is normal. Rotator cuff injury. Rotator cuff injury is when you turn the arm like a when you turn the arm like in circle. So I don't think so. So I think it could be a vascular necrosis. Let's see. Let's pick this one. Okay, guys, here we go. Oh my goodness. Sorry, guys. You shame on me. I'm sorry. Oh, I'm sorry, guys. But yeah, this is all about to learn, and this is a relatively easy questions. All the questions that are 50% answer, more than 50% answer correct. That means that's an easy question. So we have to study more, guys. So rotator cuff injury. Let's see. The patients experience a posterior glomerular dislocation followed by a fall, a stretched hand. A stretched hand is like when your hands are all the way down, stretch here, okay? Here. Yeah, you can have like a subluxation out of your glomerular cavity, like a articulation. You go back. The humor go back. Posterior glomerular dislocation. Go back. So supracondylar humerus fracture here. When you go with your arm straight like that. Ulnar styloid fracture. Okay. Scaphoid fracture too. Remember, when this happened, scaphoid fracture here, we have a vascular necrosis because the circulation of this bone is backward. Okay. So we have a vascular retrograde, a vascular necrosis. So the distal part is still good, but the proximal part get necrosis because you have a retrograde, a vascular necrosis in this case. So, guys, read, pause, read, and learn. Just remember, for education objective, is shoulder dislocation is commonly associated with rotator cuff injury, which present as a shoulder pain and difficult with abduction. Okay. This is an imaging of the rotator cuff. Rotator cuff muscles. Remember, we have the supraspinatus here, infraspinatus here. Remember, this is the back and this is the front. This is the back and this is the front. This is a front view. We have a supraspinosus in both sides. We can see it. This is the one who pull here, the humerus, and then you have abduction. Okay, this supraspinatus pull here, and you have this humerus go up. Okay. This is for rotate the humerus. When you pull here, you rotate to the back. When you pull here in front, you rotate toward front. So when the humerus come out, you have a lesion here in your rotator cuff muscles. That's why this guy cannot pull this, lift the arm. So let's try to read right real quick because my baby is here jumping on me. Kaden, you're jumping on me. What you doing, buddy? Let's learn a little medicine here. So the rotator cuff is a group of 4 muscles: supraspinatus, infraspinatus, and tenar minor subscapularis, and tendons that around the shoulder joint stabilize the humeral head in the glenoid fossa. Glenoid fossa. The RCI, the rotator cuff injury, usually present with pain in the lateral shoulder that is worse when abduction over the head at night and when sleeping on the affected shoulder. Okay, when you sleep on that side, you feel that pain. Rupture of the supraspinatus tendon is a common variant and is characterized by decreased abduction with impact sensation. Okay, so this lady is gonna read for me. Okay, hold on a second. She's gonna read here. We all come here.
was
Okay,
successfully
this
reduced
lady
in
is
the
gonna read
emergency
for me,
department,
okay?
but he now has pain and
Let me
difficulty
find it
abducting the
correct.
arm.
Let
This
me start all over.
asterisk, the
Okay.
arm is held in 90-degree abduction and release. This patient
Okay.
experienced a posterior glenohumeral dislocation following a fall on an outstretched hand. The dislocation was successfully reduced in the emergency department, but he now has pain and difficulty abducting the arm. This presentation suggests a rotator cuff injury, RCI, a common complication of shoulder dislocation in patients aged greater than 40, greater than 50% patients. Around 15% of patients may have a complete tear. The rotator cuff is a group of four muscles, i.e., supraspinatus, infraspinatus, teres minor, subscapularis, and tendons that surround the shoulder joint, stabilizing the humeral head in the glenoid fossa. RCI usually presents with pain in the lateral shoulder that is worse with abduction over the head, at night, and when sleeping on the affected shoulder. Rupture of the supraspinatus tendon is a common variant and is characterized by decreased abduction with intact sensation. RCI is not normally seen on X-ray, and examination findings may be masked by generalized pain and guarding at the time of initial injury, e.g., shoulder dislocation. However, the extent of injury often becomes apparent as the acute symptoms improve in subsequent days to weeks. The diagnosis can be confirmed with MRI. Choice A. Adhesive capsulitis, also known as frozen shoulder, develops progressively over months and causes restriction in all planes of shoulder movement, not only abduction. This is not an acute condition that develops immediately after an injury. Choice B. Avascular necrosis of the humeral head can cause pain with abduction. However, it is much more common when dislocation is associated with a proximal humerus fracture, which this patient does not have. Rarely, it can be associated with severe dislocations. The pain develops gradually, unlike the pain in this patient, who had difficulty with abduction immediately after the injury. Choice C. The axillary nerve runs anterior to the glenohumeral joint and can be injured in shoulder dislocation. It innervates the teres minor and deltoid muscles. An injury can mimic RCI with pain and weakness of abduction. However, the associated sensory loss over the lateral shoulder area differentiates it from RCI. Choice D. Recurrent dislocation is unlikely, given that the patient has no asymmetry on examination and can move the shoulder freely, except during abduction. Educational objective: shoulder dislocation is commonly associated with rotator cuff injury, RCI, which presents as shoulder pain and difficulty with abduction. RCI can cause weakness but not sensory loss.
So, okay, guys, I hope you learned something. Remember to subscribe and hit the like button and share.